member, and the majority is going to now have 60 minutes for members to make their opening statements. I'll manage that time, then yield your 1 hour allotted time. So we'll start with yielding 3 minutes to my fellow Texan, Dr. Michael Burgess, again for 3 minutes for your opening statement, sir.
I thank the chairman. Thank him for holding this hearing, and I know it is a big day for him, and certainly I will speak for myself, and I'm very proud of the work that you've done so far to bring us to this point. We got a budget that delivers by reducing the gross federal debt by over $14.5 trillion when compared to the president's budget. The president's budget appears to lack a clear plan to rein in spending. The majority has delivered a resolution that would reduce the deficits by $16.3 trillion and balance our budget over the next decade without reducing Medicare, Social Security, or veterans benefits. It's clear the president's gone too far. We can correct our course if we want to ensure that our children and grandchildren benefit from these programs. While still seeing the $400 billion in savings over 10 years, this Republican budget protects Medicare benefits and lowers out-of-pocket costs for seniors by supporting smart, site-neutral policies, improving uncompensated care payments, and streamlining graduate medical education. The budget does not cut Medicare benefits for America's seniors. As my friends on the other side of the aisle are so quick to allege, this budget actually strengthens Medicare. If we want to look at someone who has cut Medicare, all I got to do is look out my office window in the Rayburn building and see the Department of Health and Human Services. Joe Biden and his administration have refused to prioritize this nation's physicians and the patients that they care for them. Thanks to a Republican majority in Congress, Medicare Part D that was passed in 2003 and enacted in 2006, and we now know that Medicare spending per beneficiary from 2010 to 2019 has not cost as much as what was expected for the past decade. That is according to the CBO. Knowing that transformational laws like Medicare Part D take years to have an effect, I believe this ounce of preventive care in 2003 has yielded more than a pound of cure today. This, to me, proves the case for preventive personalized medicine and should only encourage us to continue this trend. This budget not only strengthens Medicare, but strengthens our doctor-patient relationships. Every American deserves access to affordable, personalized care. We are empowering patients to make informed decisions that best fit the needs of themselves and their families. This budget also supports the doctor within the doctor-patient relationship by supporting policies that really we've been looking at for years, including repealing the ban on physician-owned hospitals to decrease physician burden and bolster physician workforce. This Republican budget also ensures that Medicaid works for the most vulnerable Americans. Currently, the federal government reimburses at a 90% rate for adult expansion populations while reimbursing at a lower amount for the legacy populations, this very safety net program that Medicaid was intended. Most concerning evidence suggests that Obama Medicaid expansion adults are crowding out healthcare services for our nation's most vulnerable. In this resolution, we are ending the special treatment for able-bodied working adults that was enacted in the Affordable Care Act. For Medicaid, this budget follows the example of former President Bill Clinton and his Democrat supporters who championed Medicaid work requirements. There's no reason that this should not continue to be a bipartisan issue today. Thank you, Mr. Chairman. I'll yield back.
I thank the gentleman.